For everyone on the call, it's my pleasure to introduce Ken Parsons. I have known Ken for a number of years professionally, as he's served our patients at Now Hear This and educating them about Medicare, about Medicare insurance, supplemental plans. And through all of this time, I've grown to trust him and appreciate him on a personal basis as well. I knew that because of in this time of COVID, that more and more our telehealth is being used more, and at least the term is being bandied around and used a lot more than it was just a few months ago. And there's been questions around what it is. A lot of it, the questions have to do with insurance. Anyone in the health industry is, of course, wondering how they're going to get reimbursed and compensated if sessions are conducted by telehealth. So I reached out to Ken to, as he works with all of the different insurance companies, and I thought he would be a perfect person to give us the ins and outs of telehealth and tell us what we need to know. With that, Ken, thank you again for your willingness to do this today. And with that, I'll turn it over to you.
I don't think he knows that he's muted.
Ken, I think you're muted.
Sorry about that. I'm going to go and see if I can get this share screen going here, and then I'll make a couple of comments before I launch off. So here I go.
And if everybody can mute themselves while Ken's doing the presentation, and if you have a question, you can put it in the chat box, or you can certainly unmute yourself and ask.
Yeah, absolutely. Can everybody, or Deb, can you see this and can you hear me?
Yes, we can see it.
Okay, excellent. Okay. So yeah, I first want to say thank you to Bob and Deb for the opportunity to do this. Bob, the feeling is very mutual, both professionally and personally with yourself and, and Dawn in the office. It's just great working with you guys. We think the same way, and we're all, concerned about making things as easy as we can for those folks that are aging. Obviously, by the name of my business, Triangle Medicare Solutions, the demographic that I work with are seniors for the most part. Occasionally I have someone under 65 who's disabled and is on Medicare, but it's just my passion to work with these folks on things that are just very confusing, and with a demographic that at times can be very vulnerable. So that's my passion. That's my goal. Triangle Medicare Solutions is my business, and I help folks to understand their Medicare options. I help them, in any path that they're on, whether they're 67 or 68 and deciding to retire and have to do some special things to get signed up and get out of group health care, or whether they're just coming up on 65 and wondering, what they should do. Help them through every aspect. And then, as Bob mentioned, I'm contracted with all the major carriers, so that if they decide they want to do something like a Medicare supplement or a Medicare Advantage or prescription drug plan, I can do that with them as well. There's no cost to what I do for them, because any compensation that I get comes from the carriers. So that's a good thing. So I'm going to take you through some of the basics of telemedicine. Like Medicare, it's not something you can just, completely cover in 30 minutes or so, or 20 or whatever I have. But this will get you rolling. And this was a great education for me too, because this whole world of telemedicine has exploded, folks, as you can probably well imagine, within the last few years, and especially within the last few months. So it is a dynamic and fluid situation, to say the least. So, and you're going to see, I will address telemedicine and Medicare at the sort of second half of this, because Medicare made some major, the administration made some major changes to how Medicare treats telemedicine here as we got into this whole COVID issue. So here we go. Telemedicine, what is it and how does it work? Okay, why is that not? Hold on a sec. There we go. Oops. Okay, so what is telemedicine? Well, this is kind of obvious, but it allows a patient to receive healthcare without leaving their home, their office, their dorm room, their hotel, or beyond. And amazingly, I was shocked by this. It actually first began in the 1950s with just good old-fashioned landline telephones. And needless to say, at that point in time, the percentage of people using it was probably infinitesimal compared to now, but I had no idea that it went back that far. But that's basically what we're talking about. There are three types of telemedicine. The first one is what you probably think of as the typical telemedicine, interactive medicine. It's also called live medicine, and it's when a physician and a patient communicate in real time. But there are two other things that happen. Remote patient monitoring. This allows caregivers to monitor patients who have mobile medical equipment, and I'm going to address that and show you just some of the equipment that is available now, which is pretty incredible. And they're able to collect data like blood pressure, blood sugar levels, etc., and keep tabs on that patient, even though they're not necessarily in an interactive medicine mode like the first bullet point. And then the third one is super valuable too, and this is where providers can actually share the patient's health information with other healthcare professionals, i.e. a specialist. So you've got your primary care physician, you're transmitting over your EKG info, your blood pressure, etc., and then they can turn around and send that to your cardiologist or that type of thing, and just keep everybody in the loop so they can store and forward. So this whole thing goes a lot deeper than getting on a Zoom call or a FaceTime call with your doctor. Okay, so where does it fit? Well, it is definitely not for every situation, as you all probably guessed. It is not appropriate for emergency situations like a heart attack or a stroke, which is probably obvious, but cuts, broken bones, etc. You don't want to call and say, hey, I heard this crack, my son was skateboarding and I heard a crack in their arm. What do you think it is? You don't think it's going to be for everything. Those things that I just mentioned should be handled in person. But it is very helpful for things like strep throat, wound infections, chest infections, insect bites, colds, flu, diarrhea, pink eye, etc. Things of that nature. It's super, super valuable. The other thing it's great for, and I will tell a real short story about my daughter on the second one here, but it's great for psychotherapy and teledermatology. The psychotherapy thing, where sometimes people are, don't feel great about going into an office for this kind of treatment. Who might they see? Who might see them? People talk, blah blah blah. But for psychotherapy, it's huge. And then teledermatology. And right at the beginning of the COVID virus startup, I was talking to one of my daughters who lives up in Connecticut. And she's of a sort of a lighter skin, a little more sensitive. And she was telling me that she was about to go on and do a telemedicine call with her dermatologist. And then from that call, he was able to determine that, yes, the little area that she had concern about was something that justified an office visit, which was necessary to consider removing it, or I think they probably ultimately did remove it. So teledermatology is a great one for this as well. So telemedicine is booming. These figures are from 4/4/2020, so you guys can imagine it's probably even greater with everything that's going on. But okay, so general medical care visits are projected to jump this year from 36 million to 200 million. And that's a combination of in-person and telemedicine or telehealth. And the reason for that jump is that, you know, obviously you're going to see a lot of it has to do with the virus, but just people are getting more and more comfortable with telemedicine and the benefits that it offers. And so these numbers are just going through the roof. This is from a CNBC article that was written in April. March telemedicine visits increased 50% this year, March. And no surprise what was the main driving force behind that, and that's the COVID. COVID-19 related virtual interactions. So there's going to be, obviously, when you look at this number, this is more than one, in many cases, many more than one interaction with one patient. And it could include just going on to their My Charts and looking at things. That's an interaction. But looking at potentially topping 900 million in 2020. I mean, that is staggering. That's like 2.5 interactions per every citizen in this country. So needless to say, not everybody is doing it. So you know that a lot of folks are doing multiple interactions over this issue. 95% of company healthcare plans now offer telemedicine. Very few don't. And then telemedicine is very popular, and this is pushing the growth. It's very popular with millennials. It's less so with baby boomers. And of course, baby boomers is huge right now. But as millennials are, becoming older and getting out of the age where they think nothing can hurt them, they are very into telemedicine. So that's going to keep the growth going too. So I think, folks, what we're looking at here is, the virus has really brought this into the light. But this is the beginning of a really what I think is going to be a popular and very common way for people to get their care. So, okay, so what kinds of scenarios are people using telemedicine for as it relates to the pandemic? And because I do want to give the pandemic a lot of credit here that it deserves as far as driving telemedicine, not credit on anything else. But here's some examples. A patient with mild respiratory symptoms needs evaluation but has been told not to go to the emergency room. A patient who has no symptoms of COVID-19 but had contact with someone infected by the novel coronavirus and wants to be evaluated, and of course doesn't and shouldn't be going into the doctor's office, has to be cautious. So here you go. A patient needs care for an unrelated reason, i.e. management of a chronic health condition, diabetes, something like that, but cannot go in person due to clinic closure or fear of coronavirus exposure. A provider has been, the provider has been quarantined due to COVID-19, but can continue to see patients from their home via virtual visits. Or a patient with severe symptoms of COVID-19 is hospitalized and needs a specialty consult with an infectious disease doctor in a remote location. So you can see, and this is from Kaiser Family Foundation, there's all sorts of scenarios that many of you, I certainly did not think of all these scenarios, especially number 4, where the provider, may be under watch. So some good reasons there. Common reasons for telemedicine. Well, you live in a rural area or far from your doctor. I have a lot of clients down east in Sampson County and that area. And if they were to want to have a doctor up here in the Triangle or something like that, but it wouldn't be convenient to drive back and forth, living in a rural area or far from your doctor is certainly one good reason. You have limited movement, time, or transportation. You could be someone who is unable to drive, or time is, an issue, or what have you. This is a way for you to get some pretty dang good quality care and not have to worry about how do I get there? Do I take the county van and basically be held hostage for a day? Maybe they have a caregiver that is able to bring them, but maybe they don't. And then lastly, you need medical care while you're away from home. So I think, we would all agree if we were traveling and we were in Florida and had something severe happen, we'd go to the emergency room. But if we had something happen to us, for instance, that is related to a chronic condition or something that our physician is very familiar with, we'd want to be able to go ahead and jump on and maybe have a virtual visit with them. And that's another typical reason why people will use telemedicine. So it just gives you that peace of mind. Other reasons for telemedicine, cost. This will give you an idea. These figures are from 2017, but the average telemedicine visit in 2017 was $79. The average doctor visit, however, was $149. And the average ER visit in 2017 was $1,734. And so before people jump out and, heaven forbid, go to the ER because they, have a sinus infection, and I know most people don't do that, but there are people that panic and will do that. The telemedicine costs are much, much better. So that's a major consideration. And of course, the other one is the obvious one. The infection concern, the desire to avoid contact with others for fear of contracting a disease. And this concern is expected to continue for some time, much longer for some. We all don't know how long this is going to last, but I can tell you, just talking to and working within the demographic that I do and that many of you all do, as I listen to the introductions, there are people that are just not going to feel comfortable for quite a while. Maybe, I submit, I think people will be wearing masks like you see in, Beijing or Hong Kong or whatever daily before any of this happened. I think there'll be people wearing masks over here just like that for indefinitely. So maybe I'm wrong, but so those are a couple other reasons. Okay, so where do you find telemedicine? Who offers it? Well, it's possible that your healthcare provider does offer it. Not all do. There was a huge spike, back in March. Everybody, sort of was forced into it, but that spike has dropped significantly as far as how many are offering it. More have probably started offering it again here in North Carolina because of the issues we've had in some of the other states like Texas, Florida, et cetera. Because as you'll see, there are some considerations that they must take in investment and things like that I'll mention. But your healthcare provider could very well offer it. About 80% of hospitals have it now. So if someone were in the hospital, just like that example I mentioned earlier on, and they needed to have some sort of consult with a specialist, a remote specialist, they could do that. So a lot of these hospitals, what they have are these kiosks that they can roll around and hook you up and then get you into a virtual visit situation with someone who is somewhere else. And then you've got private telemedicine companies. These are people like Teladoc, MD, I love all the names are great. Teladoc, MD Live, Doctor on Demand, Amwell, And these are companies where they have their own board certified, doctors on contract, and you can get, get your telemedicine visits through them. And there are even telemedicine insurance policies. I know that Aflac for a while was selling them through their distribution channel. And, you would just simply, this is kind of before, I don't know how that all is going now, but because most of the major carriers have this built into their policies. But, you could get an insurance policy that would allow you to do a telemedicine visit through one of these companies. So that's an example of the type of folks that offer telemedicine. All right, so here's how it works. And I think a lot of you probably have used this. I know I have. The patient portal. So another way to look at this is, my charts, Duke, UNC, I forget, we have UNC, I think they call it My Charts. Duke, I may go by the same name. But with a username and password, the patient can communicate with the physician and their office and order prescription refills, set appointments, send and receive emails, etc. My next door neighbor had the COVID test yesterday. It was one of those where you can get the results back quickly. He went on My Charts this morning at 6 a.m. There were the results, and negative, luckily. So that would be, one way of how it works. Your doctor can also share lab and imaging test results, which, which is faster than waiting to talk to them on the phone. So, you go and you have your annual physical and they take all that blood work and all that kind of stuff. In the old days, it would be, we call them on the phone and, how did I do? How's it look? Oh, I don't understand your numbers. Now, you probably know, you just go into your patient portal and you can see all of those results and how that ranks you with others, et cetera. Or virtual appointments. And some doctors will now let you have an appointment through a phone call or video conference. That also works with mental and behavioral health as well as urgent care clinics. So you've got some doctors that are just doing the patient portal type of thing. You come on in, we'll do your appointment, blah, blah, blah. And then we will put your information in our patient portal whereby you can go and access it. And then you've got some doctors or providers that are really doing full service and doing both of these, where you can literally get a virtual appointment, et cetera. And then the results that can be, obviously you can't do blood work by a virtual appointment, but the results that can be shared in a patient portal, you'll be able to find them there. Okay. So telemedicine patient technology requirements. What do you need to be able to do this? Good telephone connection minimum. And I mean, I'm just talking either cell or landline. At the very least, you can't do telemedicine if you don't have a telephone connection. I think everybody will be good on that one. A good internet connection, ideally, because from the internet connection, you can do things like video conferencing, just like what we're on here, platform, Zoom or FaceTime, et cetera. So those are some of the key minimums. But here's another one, and I'm about to launch into this that I just found really fascinating. But the remote accessories, which are optional. So you can go on, and I have gone on, and you got something going on in your chest, and it's bronchitis, and they're going to ask you questions. You might just be on the telephone, you might be on the video conference, but they'll ask you questions, and they can really figure out what you've got, and they'll prescribe some medication, a Z-Pak or something like that. But as Bob, mentioned to me, and when he was kind of listing the questions and that people wanted to know is, okay, well, how do they take my vitals? How do they look at this? How do they look at that? And I was fascinated to see some of the things that are out there, and you'll see those in a second. Now, the physician technical telemedicine, it's a mouthful, requirements, a little bit more, a little larger. They need a secure broadband internet connection. They need a video connection and a platform to run it on. they need technology support to run the program. So, you think of a typical doctor's office, they don't necessarily have someone technologically advanced enough to just jump into all this, video and, recording and all this kind of stuff. So they've got to have that support available. Obviously, you think, from a privacy standpoint, they've got to make sure they've got that. They need a recording device, part of the video conferencing setup. They need peripherals and video assist devices. So if they're going to get into these extra accessories, this is just an example of some of the things they'll need, like a video otoscope for that is an acronym for head, eyes, ears, nose, and throat. So if you want to be able to, check someone out in those areas, you're going to need some special equipment to be able to read what's going on your patient's end. You need an electronic stethoscope for cardiovascular exams. You need a dermoscope, which is a very high resolution video camera for visualization of rashes, skin lesions, or like in the case of my daughter, that little dermatology issue that she had to get looked at. So you can see that the physicians have a far bigger hill to climb to get into this to the full extent that they could. And so that's when I talk about, there's a range, and some physicians are in it and some got in it just to take phone calls, but now have jumped out of it. And, that's kind of what's going on here. Okay, here's some of the cool equipment. And this I just took a screenshot of, and this is just one of the companies. They appear to be one of the bigger companies, but TytoCare. And I don't know if you can, I don't know if you can see, but this is my cursor, but I'm pointing to the first thing on the left that has sort of the rainbow colors. That's a thermometer type device, and it's an exam camera and thermometer. So it's got a built-in camera and a thermometer, and you actually would put that up against your forehead, and that, with the proper hookup, will transmit your temperature across to the doctor on the other end. As you might guess, this next one that has this sort of needle nose, point on top, that is an otoscope, and that's for examining the ears. So you on your end at home, you'd be able to insert that in your ears, and they can help you change the positioning, and then that's going to give them a look on their end at what's going on in your ears. You come across to the next one, and this is your stethoscope. So that's going to go up against your chest, and it's going to relay, your pulse or your heartbeat and beats per minute, things like that. And then this guy right here is a tongue depressor, and that you would insert, in your throat area, and would allow them to take a look and get a look at what's going on down your throat. And then the reason that they've got this phone is because, there's a tie-in with all of that into whatever device you're using, whether it's, over a smartphone or an iPad or something of that nature. So, that's an example of some of the things that they're using to really get a great job done in the telemedicine area. This one, and some of you, I bet, and many of you, some of you, because you're all kind of in this profession, you've seen some of those things, and I'm sure even more of you have probably seen or heard about this. This is a neat device, and I was on a Zoom call with a client of mine just a couple of days ago. His wife actually works at Rex, and she's going to be going on Medicare later this year, and we were talking, and so this is, basically the, electrocardio reading, and for the heart, he had a previous issue, and he just does this, and then it transmits it over to his doctor. His doctor reads it, and, he gets the, the all clear kind of thing, and I think they do it kind of on a monthly basis. And if I'm not mistaken, he once told me, I want to say this was like $99, maybe the app was $99, and then a relatively minimal amount for the device itself. But that's a great example of how a cardiologist can keep an eye on things from a remote position, location as well. So I thought that was cool. So let's move into the Medicare area, because there were some huge changes. Medicare had some strict restrictions on the use of telemedicine and or the payment thereof. But again, current administration, all politics aside, made some big adjustments to that once the virus hit to make, well, you'll see. So Medicare can now pay for office, hospital, and other visits furnished via telemedicine across the country and in patients' residence. Okay. Services include common office visits, mental health counseling, and preventive health screenings. Flexibility, Medicare has now has given the providers the flexibility to reduce or waive cost sharing for telemedicine visits. You remember back up there, the $79 visit in 2017, that's probably a little more like $100. Well, a lot of that's getting waived. Medicare Advantage plans, for people who might have those, they cover telemedicine and they encourage it. And from their perspective, you can imagine it's a cost saving thing for them. So they're very big on it. And then lastly, Medicare supplement plans also cover the cost sharing for telemedicine as long as Medicare is covering it. For those of you that are familiar with how supplements work, or well, those who aren't, they typically cover the 20% that Part B does not cover, but everything has to be a Medicare approved procedure. So as long as Medicare right now is approving telemedicine and paying 80%, your Medicare supplement is going to pay the other 20%. That is not to say that that will last forever. I was listening to a radio show, and what is her name? Seema Velma, forget. She's the head of CMS, Centers for Medicare Medicaid Services, and she is hopeful that all of these changes relating to Medicare covering telemedicine will actually stay in place indefinitely. So that would be a great thing. Okay, so here are some of the key changes to coverage restrictions for Medicare fee-for-service. Fee-for-service, that's the Medicare Parts A and B. That's the fee-for-service Medicare. During the COVID-19 emergency, it allows beneficiaries living in any geographic area to receive telehealth services. Prior to this, it was only allowed in rural areas. You know, something like I mentioned, you know, maybe down in a Sampson County, but they wouldn't pay for it if you were in Raleigh. Allows beneficiaries to access telehealth visits from their home. So there used to be some, restrictions as to where you could access them, like you had to be in the hospital or something along those lines. It allows telehealth video conference visits to be delivered via smartphone, because there were some concerns as far as security there, but now that's okay. Removes requirement for pre-existing relationship between patient and provider. You used to have to be an established patient of a doctor, but now since they've opened this up, your doctor might not have telemedicine, but doctor, he might be able to say, but my Dr. Joe Smith over here does. You can call him. Well, now you can go ahead and call him, and you don't have a pre-existing relationship with him, and so that's allowed. This allows federally qualified health centers and rural health centers to provide telehealth services that they were not allowed to prior, and also allows some services to be delivered via audio-only phone, so no visual. So those are some the big changes that happened when Medicare made the big telemedicine changes that Medicare made due to the COVID emergency. All right, so the types of allowed Medicare virtual services. First one, Medicare telemedicine visits. This is the provider, this is that face-to-face thing, and the provider must use interactive audio telecommunications system that permits real-time communication. So that's a Medicare telemedicine visit. They can also do just a virtual check-in, which is described as a brief communication service with patient contacting practitioner via telephone or video communication. And they can also do just an e-visit. So this would be like a MyCharts thing where it's a non-face-to-face patient-initiated communication with the doctor using online patient portals. I want to go in, check my results, send my doctor an email, you know, should I be concerned about this cholesterol reading or not, etc. So those are the types of allowed Medicare virtual visits that will be covered. And that covers pretty much the spectrum. All right, coming in the home stretch here, considerations. Do it, don't do it. For patients, first consideration, or one of the considerations, access to the technology. And you know, in this case, I'm talking about those accessories. You know, I'm a patient, I'm concerned about the cardio, but you know what? I can't pay for that app, you know, that nice little finger strip there application, or I can't really afford that package with the tongue depressor and the stethoscope and all that. So that's a consideration if you really can't afford those accessories to give you the breadth of care that you're looking for. Technology aptitude, can I handle that? You know, folks, a lot of the folks that, you know, that I have on my Medicare, they're not necessarily, you know, super tech savvy. I can't have Zoom calls with a lot of them. You go down east into that area, you really have some technological challenges. So that's certainly a consideration. The quality of care, I will tell you that overall, these surveys are saying that it's pretty dang good, but tying in with this last one, there's just no substitute for that personal touch, that doctor that you've been seeing for, you know, number of years. They know what you're supposed to look like. They know how you walk. They know how you talk. And now they're seeing you in person, and all of a sudden they're seeing something in your gait, or you know, so you are going to lose out on that. That's certainly a consideration. From the provider standpoint, some considerations. It's an investment, yeah, you know, and in some cases, quite a sizable investment to not necessarily make any more money. In fact, probably make less money. Workflow and training. It definitely disrupts, you know, how things go. They're all used to, you know, you come in, you sit in the waiting room, and you're A, you're B, you're C, and here you go. And now all of a sudden, you know, part of their world's flipped upside down, and there's 2 people in the waiting room, and there's 4 people in the queue to get a virtual visit, and the training that goes along. Malpractice and liability insurance. This is one that some of you might not have thought of, and I didn't either. But what are the ramifications if someone does a virtual visit and something is missed? So that's a consideration too. So if we kind of, you know, button it up here, the pros, as I see them, convenient, no question. Less time in a waiting room. It's cost effective. It's safe from COVID-19 virus. Increased efficiency for transmission of MRIs and X-rays onto your specialists, things like that. Reduce travel times. Needless to say, I'd say maybe like eliminate travel times. Easier for in-home caregivers. I think this is huge. You know, my mother-in-law and my wife were in-home caregivers for my father-in-law who passed away early this year, had Alzheimer's. They didn't know about all this kind of stuff, and I think it would have been a challenge to get involved. But now, as I've learned more, if I had to do all over again, I could see so easily how getting set up and how it would be so much easier for the caregivers. You're not moving the person, not risking falls, things like that. So they could really facilitate something there. It's currently accepted by Medicare, Medicare supplements, and Medicare Advantage. So that's a big pro. Privacy is assured. If they're doing it the right way, it very much is assured. And then lastly, the technology that allows you to go way beyond what your typical video scenario used to present. Cons, well, electronic glitches. If you have a power outage or bad weather or bad internet connection or something like that, you're kind of out of luck. Lack of access or aptitude to technology, lack of access through costs or what your internet will support. and just lack of your aptitude for that kind of technology. Physician resistance. Is your provider on board? And if they are on board, how deeply are they, committed and invested to go beyond just the, some of the basics of telemedicine? And then lack of personal touch, as I mentioned, or feel when evaluating a patient. That's big. And in the Medicare, in my world, it's especially big. I mean, that trust factor, you all know how that works with folks that they have someone they trust, that they bring their car to, and their doctor, and their this and their that, and where they get their groceries. And the same thing works with me. When I build, rapport and trust with them, I become a trusted advisor in what I do with them, and they don't change too quickly. So that's definitely going to be a con and a challenge. So I will just mention quickly, from the standpoint of this kind of coverage being paid for. I know I have a Blue Cross Blue Shield, plan through the, the exchange. I've got a magnet right on my refrigerator, and any calls that I, make, for bronchitis or whatever, there's no cost. So they definitely want to encourage it. With the Medicare Advantage plans, your companies like United Healthcare and all that, it's very clearly and boldly spelled out in their summary of benefits of teledoctor, whether it be someone through one of those type of companies that I mentioned, or your own doctor. It's covered, folks. They encourage it, and that's totally covered. And then we've talked about how Medicare, if someone has Medicare and a supplement, we've talked about that being covered now. And I don't have a crystal ball, but my guess is that that's going to be something that's going to be around for far longer than the virus. And I hope I'm right about that. So with that, I will open it up if anyone has any questions.
Ken.
Yeah.
Just as an FYI for you and for others on the call here, there's also hearing aid providers, audiology providers are offering telemedicine. With the latest technology, you can actually adjust hearing aids remotely using the app on their phone, which interacts with the hearing aid as well. And so that is a real convenience to people that want to stay at home and yet find their hearing changes and need to have a quick adjustment from the audiologist too. So that's all just come about in the last 6 months or so.
Wow, that's great. I did not know that, but makes sense.
Yeah.
Yeah.
I just wanted to say thank you so much. Very well put together and presented well and very understandable. Thank you very much.
Oh, it's my pleasure. It was fun to do. Learning is fun, they say, and it was fun. It was really fun to do, and I learned a lot. I can, now, when I sit in front of some of the folks that I have as clients and prospects, I can really speak intelligently about some options that they may have if they've, really got an elevated level of concern about going out and going to the doctor's office and that type of thing. So I feel good to be able to speak from a position of knowledge there. Yeah.
I have a question, Ken. That was amazing, really. I mean, all those little devices that can check your heart, and I mean,
Yeah.
so I know one of the cons was the cost of those devices. So I'm wondering, does Medicare, is that something the patient pays for, and does Medicare not cover those devices?
That's a good question. And if they're covered, and I suspect that I'm going to find that out a little better, but that would fall under durable medical equipment, which is Part B.
Okay.
And, the good news is that the cost isn't, when I do those things and I talk about cost, I don't want to be presumptuous and, something that's expensive for one person might not certainly be for others. I really find that out when I'm dealing with some of the, the folks down east. But I want to say that package, that first package I showed, was something like $230, $250, something like that. So it was surprisingly less than I thought it would be. But I gotta believe that Part B, durable medical equipment, should cover that.
Okay, thanks.
Yeah. I'm going
I have
to,
a question.
yeah, go ahead.
Ken, could you share with us your contact information?
You read my mind, Deanna. I was just about to pull that back up because that is the last slide, and you can still ask questions, but I'm going to pull that up so that you have it. And that is right there. So cell phone and website or email and website.
Ken, have you become a member of NAIPC yet?
I'm about to. I have not. This was kind of, when you asked me about doing this, this is the first kind of that I knew of the organization. I mean, I had heard of it, but I'll do it. Does anybody need me to leave that up there? Or are we good?
Well, we would welcome your membership.
Yeah, absolutely, Bob. And I think, I'm trying to get off this. Well, I guess I'm going to talk from, okay, there we go. And I think that from a networking standpoint and the demographics and all that, as I listen to everybody introduce themselves and what they do and where they work and all, it seems to me like it's kind of a no-brainer. I think we can all be of some assistance to each other. So I think I'd be crazy not to.
Well, are there any other questions for Ken before I wrap up here?
Just one comment. There's another device where the information doesn't go directly to your doctor, but you can send it, and it's a blood pressure cuff that connects to your phone and it records your blood pressure. And we use it, and the pressure is really correct, and it's very easy to use.
That's great, Netta. Thank you for pointing that out. I had not seen that, and that should be one of the more obvious ones. So thank you for adding that.
It's made by a company called Withing.
Okay. There you go.
Well, I just wanted to say that through this talk, it's so clear to me how important virtual connections are from now on, and how our seniors really struggle with having that good internet connection, maybe even having a smartphone, knowing even how to get on Zoom and how to use telemedicine. So certainly the National Aging in Place Council is aware of this, and I believe the topic of our Aging in Place Week is going to be virtual or digital communication for seniors. So we're going to be really having to strive to make sure our seniors are up to snuff on what they need from, I mean, like you say, Ken, it's not going to just be until a vaccine's out. I think this is going to be an ongoing thing that we're all going to need to know about.
Yep. And you're absolutely right, Deb. And if you think about all the professionals that are on the screen right here, who know to some extent about telemedicine, but folks, if we all go back to our clients and say, tell me everything you need to know, everything you know about telemedicine, it's not going to be much. Mm-hmm. So we need to educate and give them some options, and that's why we do what we do. So.
And with that being said, I forgot the disclaimer that we were recording this session. So I hope that everyone is okay with the fact that we have been recording this, and we are going to be sharing it, hopefully through the NAIPC website, but I think it's such valuable information to have out there.